It's another day with the physicians where your health is our business.
With growth towards the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what do you know?
You're welcome back to the friends of your regular program. Malaria signs and symptoms typically begin within a few weeks after being bitten by an infected mosquito. However, some types of malaria parasites can lie dormant in your body for up to 1 year. On today's program with the physicians, you will learn more about malaria. Yeah, it's your regular program, The Physicians, where your health is our business. Today we're talking about something that is endemic in our environment, malaria. The risk factors, the causes, the types, complications. Well, you have to stay tuned to ensure that you get all the information that is required. My name is Dr. Maxina Agbere, your regular host on this program, The Physicians, where your health is our business. I'm not alone as usual. I have with me my very elegant, radiant, and beautiful co-host, Dr.
I'm Dr. Memuna Yusuf Kadri, and I hope you keep up the energy just the way I have so much energy, and I'm sharing so much with you today. Welcome on board.
Yes, we're talking about malaria. It's something that has been, yes, we take it as normal because we already developed herd immunity.
Yeah.
When you talk about herd immunity, it just means you've had it a couple of times in your environment and it's not life-threatening. And a certain percentage of your immune system has actually developed against coming down with serious challenges. But then
people still die from malaria. It's still a cause of maternal and infant death in mortality in Nigeria.
In Africa as a whole.
The complications can be very deadly. At least I know then back then in secondary school we had one of our classmates who just started, having what we call right now, what I would call irrational behavior. And it was cerebral malaria. It was malaria she had, and people just started assuming, oh, she's gone crazy, there's something terribly wrong with her. If only that was managed properly, or it might have been managed properly, but it escalated.
And one of the reasons why I actually studied the course medicine, why I'm a medical doctor today, growing up, I lost a sibling, and I actually saw her at our inter-house sport when I was in secondary school on a Friday. By Monday, they came and picked me from the school. I got home and lo and behold, she was gone. What happened? They said it was malaria. Why? They said she had this fever and all those things. They gave her medication. They went to hospital. And the sad thing is, she had anemia.
She
became anemic because of the malaria that she had. So she, it was so
preventable death.
Yes, and the most painful thing was they needed to transfuse her, but the doctor was not around. The doctor was not available to sign. So my daddy kept driving around town looking for the doctor to come and sign. And the nurses said they can't do anything unless the doctor gives that instruction.
Failure of the healthcare system.
Then my sister died. So and I was asking, what happened? What happened? So with that reason, I said, okay, I need to know. I want to see how her own and my other brother who also passed on with jaundice. I said, why are they all dying like this? So I said, okay, when I'm a doctor, I will be able to know why they died. So
what are you doing now to change the system?
Of course, that's what we're doing on the physicians. That's a passion.
At least the advocacy.
Yes, advocacy. Let people know malaria is deadly. It kills. Especially even in pregnancy.
Yeah.
In pregnancy, this is preventable.
The extremes of life, young babies, elderly people, these are a group of people that you shouldn't even joke with. And so when a baby kind of presents with what it looks as if it's malaria, even if yes, they say malaria management should be at home, still seek the help of a healthcare expert that will tell you what to do. If you have to even go through the herbal route, because quantifying it is very key.
Anyway, we have an expert that will talk more about that, especially about the myths. When patients will come and tell you, doctor, I have malaria, I had so much mosquito bite last night and I have malaria. We'll talk about the myths, okay?
Exactly.
So don't go away, we'll be back after this time out. Just stay tuned. Welcome back. If you are just joining us, you're on to your regular program, The Physicians, where your health is our business. We'll be discussing malaria, like I said earlier on. And in the studio with me is a very, very important guest. She is a consultant, public health physician. And guess what? Past president, Medical Women Association of Nigeria, Lagos State Branch. Dr. Malaria Bakari, you're welcome to our program.
Thank you very much.
Nice having you here.
You're welcome. You look glamorous with the bling, bling, bling.
Yes, as a public health physician, we want to be talking about malaria. I'm sure you're on terra firma on that aspect. So let's roll. Malaria. Do you want to talk about the prevalence? Just give us a general overview of malaria. Why is it? How common? What is actually everything you want the public to know about it?
Yes, thank you very much. I'm glad to be here. When we talk of malaria, malaria is a disease that is caused by parasites and is very prevalent in our community here. It's disease that the parasite is what we call Plasmodium falciparum, and there is this mosquito. It's caused by mosquito. The bite of an infected mosquito. Without a mosquito, there won't be malaria. So there is always the infected Anopheles mosquito that causes malaria. That means the mosquito is the vector. And it's very prevalent in our environment in the sense that if we have about 10 people that visit hospital, about 70% come down with malaria. So that shows how prevalent it is. Wow. And we also look at what are the groups that are most affected. The young, very young, under 5 infants, because of their low immunity, and the pregnant women. Of course, you know, when a woman is pregnant, a lot of physiological changes are going on. And then the elderly, because their immunity is already weighing down. So those are the extremes of life, and then the pregnant women. So it is a disease that is in our community, and people don't even see it as any disease. And it can be very bad. It can cause death. It can really be very bad. So it's something that we need to be talking about, talk about it, and people need to know how to prevent it, what are the risk factors in their environment, and how to prevent it. Of course, in a year, a normal person can have 1 or 2 malaria episodes in a year. But if you are for children, you can have up to 6 times in a year because of their low immunity. So it's something that's common here. But because maybe our environment, we think that things are not, people take all sorts of things. So they sort of don't bother when they have little things, and because of the stress level in our community, people take all sorts of drugs, and then they can even attribute malaria to other things. They don't even bother. But then it can be very deadly.
You as a public health physician, you talked about the environment.
Yeah.
Are there things that can actually aids the parasite to get to the stage of infecting an individual? I'm talking about related to your plants, in-house plants, water, stagnant water, and all those things.
To be sincere with you, malaria is an environmental problem because the mosquito that causes malaria breeds in water, stagnant water. And you know, in Africa and sub-Saharan Africa, we have abundance of rainfall. And of course, because of the high humidity in the environment. So anywhere, any container where water is left for some time, mosquito can start breeding. And before you know it, the egg, the larva, and the pupa forms. So and because one, also, we also look at the peculiar nature of our environment, potholes everywhere. Containers, people throw rubbish everywhere, make things, or tires everywhere. Anywhere that is sort of a receptacle, you know, container, mosquito can breed. So it's everywhere. It's an environmental problem. Once we are able to resolve our environmental issues, and also drainages, stagnant, they are not cleared for days, weeks.
The rains are here again.
The rains are here, and then, so those are some of the things.
So I'm happy we're discussing this, Dr. Bakare, because it just gives us hope, and for our viewers out there, that we can actually eradicate malaria if we genuinely want to do that. It's possible because it's mainly an environmental thing. So that means if we take care of those things, the roads, no potholes, stagnant water, and all those other things, that can, to a large extent, we can eradicate.
We can eliminate
the vector. So I want, because you're an expert in this field, help us demystify these myths. Are they myths or facts? One of them is that you can have malaria twice a month. Another one is that if you are AS, you will not have you don't have malaria as much as your blood group. You are AA or your blood group. Another one is that even if you were born in Nigeria and you happen to relocate, when you are coming back, it's good for you to take that shot before coming back, because if you come back, you are going to have a more severe form of the malaria because you have not been in the environment. Facts or fiction? And there are more of them. Please help demystify this while we are on this platform.
Let me start from the last one in terms of moving from area where there is no malaria and then you come back to an endemic. We call it endemic because we have malaria throughout the year. It's possible. One, because we are in the endemic region, we've already developed some sort of immunity. It may not be perfect, but at least we have some level of immunity. If you have gone to some developed countries where there is no malaria parasite, they have not been bitten, they don't have immunity. If they move here to a high endemic area, of course, they may have malaria that will be very severe. Yeah.
So this is a fact.
It is a fact. The other one is about the blood group. Yes. There are a lot of things about the blood groups that if you are blood group O, you don't have very severe malaria. But the other groups, A, B, or B, they may have severe malaria. But for O, we are told that it's protective.
Okay.
The other one is...
if you can have malaria like twice a month.
Because if you
have to look at the incubation period.
Incubation
period is about 10 to 15 days. So it's not possible for you unless you are immunocompromised, and that could be extremes. It's not likely. Probably once a month when you are very down.
Okay.
It's not like... because you have to consider the incubation period 10 to 15. At least the mosquito must have bitten you before it goes through stages in the mosquito before, you know.
So, Dr. Bakare, she talked about the myth of malaria just now. Is malaria contagious?
Malaria is not contagious.
It's not contagious, right?
It's not contagious at all.
Okay. So let's go to another question. How many types do you have? Because I hear people talk about cerebral malaria, malaria that has gone to the brain, you know, a lot of things, and they can make somebody even go crazy, looking for help from Dr. Mimuna. Really, yes. You want to tell me more about it? So what types? How many types do you really have?
Yes, we can have one cerebral malaria too, which when it's severe, it can affect the brain.
So cerebral malaria, there's a malaria that affects the brain.
Yeah, when it's
so you mean it can go to the extent of affecting the brain?
It can even be deadly. It can cause death. We can also have uncomplicated malaria, which we just have fever, headache, no other untoward symptoms. And it can be severe. Severe, which is the severe malaria.
So the uncomplicated malaria is the type that we see regularly then?
No, uncomplicated malaria is what we have.
Okay.
Just fever, headache, malaise, body pains, that's all what people most people have uncomplicated malaria.
So let me ask you this. Is it every time that you are bitten by a mosquito that you have malaria?
It's not every time.
It's not every time.
It's not every time.
So
like we said, we have some immunity.
Yes.
You can be bitten, the parasite may be in your body, but if you have the immunity, you may not come down with malaria.
Because of the pandemic, we've been talking about malaria. The first thing they tell you is malaria. If you feel that you have malaria, just go and do screen and also. First, maybe you should tell us about the symptoms of malaria.
What are the symptoms of malaria? The main symptoms of malaria: fever, hot body. Then you can have a headache, body pains, bone pains, dizziness, diarrhea, vomiting. By the time it gets to that, it's already affecting other parts of the body. Some people can even have respiratory cough and all those stuff, depending on your health status. But the main thing is fever. And fever, it could be subjective. Of course, you have to take it with a thermometer. Some people may say, your body is very hot.
No, it's not.
As a doctor, a health worker, you need to be objective. Use the thermometer to do that.
Dr. Baka, you just hold on. When we come back from the break, you will tell us why the link between malaria and COVID-19. We'll be back after the short break. Just stay tuned.
Yeah, the last time was about 2 years ago now.
Yes, I've had malaria about 2 years ago.
Yes, of course. 6 months back.
Yeah, my body system will not function very well, and I will be feeling dizzy, and also I will not eat well.
I feel feverish, I have headache, and I have waist pain.
I was feeling feverish. It was fever, so I was feeling feverish.
I follow doctor prescription to treat myself.
Okay, I use orthodox medicine because that's what I believe in.
Orthodox. I feel that is the best way.
Orthodox drugs.
It can be prevented through like fleeting of your using mosquitoes. In short, getting rid of mosquitoes around you.
For me to prevent malaria is for me to make sure my environment is clean.
Do away with stagnant water.
I feel it's not right. People should go to the doctors to examine them.
I believe it's good.
And sometimes self-medication, it's actually good once you're a person that don't have malaria often and you know what works for you.
I don't think that there's anything wrong for you to get any malaria drug to take, but after 3 days, just like they always said, if the symptoms persist, you have to consult your doctor.
Welcome back. If you're just joining us, you're onto your regular program, The Physicians, where your health is our business. We've been discussing malaria, and in the studio with us is a consultant public health physician, Dr. Omowumi Bakari, and also a past president of Medical Women Association of Nigeria, Lagos State Branch. She's been talking about malaria. And I want to ask her this question. What is the link between malaria and COVID? Because when you talk about the temperature, the next thing is maybe you have COVID. Now it is COVID-19. Yes. So what is the link? Why?
Well, there are similarities and differences. That's the way I put it. Malaria is caused by parasites, and it has a vector-borne disease. COVID-19 is a viral disease caused by coronavirus. And it's through respiratory, you have to inhale it. Yes. Unlike malaria, it has to be bitten by a infected female mosquito. The similarities that you can see among them are the symptoms. Okay. The fever, of course. In this part of the world, most people thought they had malaria, whereas they had COVID-19 fever, body pains, dizziness, diarrhea, vomiting, all those things. Those are some of the symptoms. But the only difference that you'll be able to know is when you do a test.
Okay. But there's that school of thought that because we are sub-Saharan Africa, we're in a malaria zone, the postulation that COVID will, really affect us is not really affecting us. And one of the things studies are showing, or is it by maybe observation, or what we are assuming is because we've built immunity over time because of the malaria we've had. Is that a school of thought? Is it something that is now properly documented, or the researchers are still ongoing that,
COVID.
Because we are in this part of the world, that's why a number of us are not coming down with the COVID-19?
Well, there are many schools of thought, exactly. And there are so many controversies around in the world. Fortunately for us, in Africa and sub-Saharan Africa, we have been, not just Malaria, we have been exposed to different types of parasites, all sorts, bacteria, virus, protozoa. So we've developed various types of immunity to anything. So if anything is coming viral, we sort of have some, resistance to it, no matter what. Of course, it was predicted that COVID-19 was going to be deadly in Africa. They were surprised because they did not realize that innate immunity was there for us. And studies are still ongoing to know how these people survive this thing, and then everybody will do anything. They will keep looking for it.
Okay, so now let me ask you a question. How do we manage the treatment?
Or I think maybe we should ask, what's the current standard WHO treatment?
Let me start from, like we say, malaria is with us. Everybody says I have malaria. Anytime they feel stressed, this thing is malaria. No, it's not. It's better for the malaria, if you feel malaria, to be tested. However, malaria treatments, there are standards by WHO. In the past, it used to be monotherapy. That means using chloroquine or the sulfadoxine pyrimethamine. But now, we have a combination therapy, which is artemisinin-based combination therapy. It has to be 2 or more drugs. And these are there in our pharmaceutical shops and even our health centers. They are there to be prescribed. But it has to be combination therapy. But most essentially, malaria can be treated at home. In fact, WHO has advocated that it should be treated at home, and that is giving people information. So this is a platform that people should know that you can. Most of the community pharmacies have been trained on home management of malaria, where the combination therapy is prescribed for people to be treated. And not just treating malaria, you also need to develop your immunity to eat well, so that you don't have severe malaria. You can have malaria, yes, uncomplicated, but you don't want to have it. So eat well, sleep well, drink water.
Dr. Mobaka, I can assure you we're going to invite you again to come and talk about another public health concern. So nice having you on our program, The Physicians, and we look forward to seeing you again. And to our viewers out there, I'm sure you actually benefited from what Dr. Bakari just talked about. Malaria is endemic in our environment, so you have to keep your environment safe and clean. And of course, we talked about the breeding sites, stagnant water, water that is not moving. That is where it actually grows, the vector. So try as much as possible to keep your environment very clean. Sweep, just ensure you do your normal cleaning, environmental sanitation, it is said. Well, same time next week, ensure you keep a date with us on your regular program, The Physician, where your health is our business. Keep blessed.
I remind Dr. Una Yusuf Kadri, and please don't forget to follow us on all our various social media platforms, Twitter, Instagram, Facebook, and of course, a repeated program always comes after the normal regular day that this program is aired. And if you want to watch other programs, YouTube is there for you to, reach out to. You want to be a guest on this program, we're just a click away. So till next time, remain blessed.